Hi, my name is Miriam Naiman, a senior advisor in the Post Aliyah Answers and Advocacy Department. In our department, we all have our particular specialties, and understanding the healthcare system in Israel and navigating the national insurance system in Israel happens to be one of my specialties. I look forward to spending the next 40 minutes with you so that you can arrive having a better understanding on what the Israeli healthcare system is all about and how you will fit into that system.
Hi, my name is Sarah Nearer. I am a team manager in the Aliyah Guidance Division in the Pre-Aliyah Division of Nefesh B'Nefesh. Majority of my experience over the 8+ years that I've been working here is with the senior population. So I am very thrilled to join Miriam in helping to explain in as clear a way as possible how the Israeli healthcare system works and what you should be thinking about as you prepare to move to Israel regarding your healthcare. Everyone wants to understand the healthcare system. How will I choose a healthcare provider? Is it free? Should I keep my foreign insurance? Will my medication be available in Israel? Will my doctor speak English? These are some of the many questions that we hope to cover today in this presentation. This slide represents a visual overview of the Israeli healthcare system. At the top of the page, you'll see the logo for the Bituach Leumi, the National Insurance Institute. It looks a bit like a menorah. The Bituach Leumi is the body responsible for healthcare registration, payments of various pensions, and various allowances and insurances. The four Kupot Cholim, singular is Kupa or Kupat Cholim, are listed below with their respective logos, Maccabi, Me'uchedet, Klalit, and Leumit. They are the service providers for healthcare in the state of Israel. Coverage is identical for all four of these health providers at the basic level. You, as a new Oleh, a new immigrant without Israeli background, will receive immediate full coverage upon landing in Israel. Those of you who have previous Israeli status will be covered as well from the time that you land, but there may be a short gap until you can prove your residency in Israel. People who previously lived in Israel on an A1 temporary residency visa may take longer to prove residency in Israel and therefore may have a longer gap of healthcare insurance. We recommend that you bring with you, if that is your status, some private coverage to cover that time period. It can be up to 3 months. Usually it is less, but we suggest that you bring 3 months coverage.
Sarah mentioned the Bituach Leumi, the National Insurance Institute. There is no separation between the relationship of the Bituach Leumi and your healthcare providers. Many of you may say, you know what, I have my foreign healthcare benefit through my retirement package. I don't need to pay into Bituach Leumi. I don't need to pay into the Kupat Cholim system. By law, I'm reiterating what Sarah had said, everyone must be part of the national insurance system in Israel with having a choice of a healthcare provider. How you decide to utilize that choice is up to you. But being part of the system is not a choice. It is obligatory. The Bituach Leumi, as Sarah correctly mentioned, is responsible for all insurances and pensions in the country. Let's begin with the question, who is a retiree as determined by the Bituach Leumi? A man is determined at the age of 67. Being a retiree has nothing to do if you are working or if you are not working. It has to do with age. A woman who is born before December 1959 will have the retirement age of 62. For a woman who is born from 1960 all the way up to 1970, will have the retirement age anywhere from 63 all the way to 65. How can you know? As you will see below, the the link for the Bituach Leumi where you can find where your age range falls. Everyone pays into the healthcare contribution if you are now over the age of retirement. In 2025, the Bituach Leumi updated their tariff, their fee, to 120 shekel monthly that each individual who is over the age of retirement will pay in order to be part of their chosen Kupat Cholim. We will talk a little further on about what it means to pay to your Kupat Cholim and what it means to continue to pay to your healthcare contribution. But again, I am reiterating that everyone must pay a healthcare contribution of 120 shekel a month. It is so important that if you are listening today, but really don't plan on making Aliyah for another year or another 2 years, make sure that the information that you are writing in your Aliyah notebook today is up to date, is really the way things are whenever it is that you will be making Aliyah. If you are below the age of retirement and are not working, you will still have a contribution. This is called a national contribution. And as you see here, you will have a monthly payment of 250 shekel monthly. If you are working and continue to work abroad, please speak with an accountant who is fluent in either American or Canadian and Israeli tax law to understand what your obligations to the Bituach Leumi will be. When you hear about the healthcare benefit of not paying healthcare or free healthcare for the first 6 months, this is because the Bituach Leumi, the National Insurance Institute, is going to give you a benefit of not having to pay into the healthcare contribution for the first 6 months of your Aliyah. As you see here, there are two very important words: residency and citizenship. Upon your arrival, that's your goal. You're going to become citizens of the country even before you collect your luggage. And you never lose that citizenship till 120. Residency is where your center of life is. Where physically do you spend the majority of your time? Now, there may be those of you who are going to continue to keep your home abroad and you have family abroad, you have a family member that you need to be responsible for, you have your house in Florida, you know who you are, and you know what your lifestyle is like. It doesn't mean that you can't travel. But in particular, within your first year, the Bituach Leumi wants to see that Israel is indeed your center of life. And so, if you're making Aliyah, and you know that you're going to be traveling soon after to close up your business, to sell your house, to visit somebody, to see, have a simcha, for whatever that reason is, please be in touch with the Post Aliyah department so that we can guide you on how to inform Bituach Leumi. Yes, I'm leaving, but I'm also coming back. I don't want to lose my residency, because when you lose your residency, you also lose your health care. And that's a very scary thought.
This is our roadmap for some of the topics we're going to speak about today, and some of the concerns some of which I mentioned earlier on. And let's get into the details of them right now. As Miriam mentioned, this is a universal system that is available to all residents of Israel, regardless of age or pre-existing conditions. And it is obligatory. Those of you who have insurance that you are bringing with you from the U.S., from your employer, from your pension, that's amazing and good for you. It does not negate your obligation to pay into this particular system. I know we've said that now a couple of times, but it is really super important. As I said earlier, registration is influenced by your Aliyah status. I'll repeat quickly that new Olim with no previous Israeli status are registered immediately upon entry to Israel. Your Aliyah advisor will ask you for the name of the kuppah that you choose to join, and we will talk in a little bit about how one chooses which kuppah to join. That will be requested of you at least 2 weeks prior to your arrival so that there is a smooth transition when you land with the correct information, and you will be registered with that kupa, with that health provider. Those of you who have previous Israeli status, meaning that you already have an identity number or Teudat number, will also have immediate coverage, but please speak to your Aliyah advisor to discuss the fine details of your medical coverage when you land.
But it is an amazing thing, if you think about it, Sarah, that as people are registered as Olim Chadashim, as new citizens when they arrive, they are covered by the healthcare system, regardless of age, as you mentioned, and regardless of any previous existing conditions.
Which Kupat Cholim you join is your choice. We will ask you at least 2 weeks before your Aliyah to let us know which one you are choosing. You can change your choice. You can make a different choice within the first 2 weeks after your Aliyah, as well as twice a year at certain set times during the year. So you are never locked in to your first choice or even your second. We have liaisons to each of the different healthcare organizations, each of the different kupot, and we can provide you with information about how to contact them as needed. Remember again that each of these providers at the basic level of insurance that is enacted by law in Israel offer the same basic level of coverage. There is a supplementary plan, 2 different supplementary plans for each of the different providers, and we urge you to investigate and research those plans, and we very much recommend that you choose at least one level higher than the basic level when you land. How do you decide which of these to choose? We recommend that you ask friends and family in the city that you are hoping to move to for a doctor's recommendation. Confirm that that doctor has an open practice, meaning they are still accepting new patients. And then choose that kupa based on the kupa that doctor is working with. Which doctor? It could be that for you, your primary care doctor, which in Israel is called a family doctor or general practitioner, is the most important person in your medical life. Then that's the name that you should be asking for. However, there are maybe some of you who a specialist is really your most important doctor. You need a neurologist, you need a gastroenterologist, whatever specialist you might need, and that's crucial to your well-being. Ask around for recommendations for that specialist and choose your kupa based on the availability of that doctor with that kupa. You should also ask your doctor in Canada or the US whether they know doctors in Israel who they would recommend and work that way. It doesn't have to be just by family and friends. As I said, you are able to switch. What might be a reason that you would switch? You're moving cities. You're going from Beit Shemesh to Rehovot, and the availability of services in those 2 cities is different for the different kupot. That might be one reason. You have a change in your healthcare needs, and you now do need a specialist, a particular specialist that you want to have access to, and they don't work with the kupa that you have chosen up until now. You can switch to a different kupa to get access to that doctor. You may also be just generally not happy with the doctor you've been seeing and you want to go to another one. That might just require switching doctors and not switching the kupa, not switching the healthcare provider, but that will be an individual decision.
I just want to reiterate that you want to make a smart choice. This is a good place for you to do a lot of research and networking depending on your personal needs. It's important for you to be proactive when it comes to researching how your medical needs will be met. You may have a family member who is within the medical system in Israel, somebody who's a doctor or who's a nurse, who will just say, oh, I'm part of this kuppah, you should also join that kuppah. But is that person within the same age range as you are? So when we talk about networking, not only do you want to network within your city, but you want to network also within your age group. Because as we all know, we all have different needs depending on where we are in our stage of life.
I want to just add that you can upgrade your coverage. We talked about at the airport, you get the basic level of coverage, and you can choose the supplemental program and upgrade without penalty during the first 90 days after you arrive. Should you choose to change after the first 90 days and you want to upgrade to a higher level of coverage, there may be waiting periods or qualifying periods for those added services. So we've talked about the first level of topics in our roadmap to understanding the Israeli healthcare system. And now I'm going to turn it over to my colleague Miriam to discuss some additional parts of the system.
What comes beyond the basic level of care? Sarah mentioned about supplemental level. Every kuppah has 2 levels of supplemental care and a 3rd level of what's called elder care. That is something that offers you caregiving opportunity or perhaps a discount in a nursing home till 120. Having elder care through your Kupat Cholim is something that is determined by age and pre-existing condition. When it comes to the 2 levels of supplemental care, again, age and pre-existing condition are not at all taken into account. What is taken into account in terms of cost is your age. For most of the Kupot Cholim, you will not pay anything past a particular age, typically between 71 and 75. And why don't I sound like I'm giving you a definite number? Because things change. Things change all the time. Israel is dynamic. And as the population ages and we see that more and more people are, thank God, growing older into their 90s or beyond, it could be that by the time you are ready to make Aliyah, it will not be that age group of 71 to 75. It might be 75 to 80. So again, I'm inviting you and encouraging you to please make sure that your information that you are collecting prior to your Aliyah is always up to date. Registering for supplemental insurance will be something that you will do at your local clinic. The clinic is where all administrative and medical services are provided for, regardless of your kuppah. That is where you will see your family doctor, and for many of you, that may be where you see a specialist, or you may decide to see a specialist in a hospital. The specialist in the hospital will have clinic hours where instead of spending 36 shekel or more to see that specialist in your kuppah, you'll see him through his clinic hours. When you have supplemental insurance, it also gives you the opportunity for a designated amount of time during the year to see a doctor on a more privatized level. That means instead of a doctor spending perhaps up to 10 minutes with you in the clinic, he may spend even up to an hour with you. Why will you see this specialist on a more privatized level? It may be because you want a second opinion. It may be because you're having a harder time seeing that specialist within the clinic hours, and now you're willing to pay a little bit more. What does a little bit more mean? It depends on your kuppah choice. It may be 200 shekel, it may be 300 shekel. As your financial participation to see this specialist on a more privatized level of care with your kupat cholim paying the remainder of that visit. Again, it's determined by your chosen kuppah on how many of these private visits that you can see throughout the course of a calendar year, and it may even depend on the level of supplemental care that you have. Now, most of you may be saying to yourself, well, it doesn't really matter. We're just going to take the highest level of supplemental care. And of course, that's your choice. But I do encourage you, we encourage you to understand what you're paying for. There is a website sometimes available from abroad, sometimes not, but you can certainly ask your pre-Aliyah advisor for that site. It is called call.gov.il, where you can compare each of the different kupot one to the other to understand what is within the basic basket of services as determined by the State of Israel, by the Ministry of Health, and what is covered and available through the supplemental level of care. What about nursing care? I'm going to talk about nursing care in two different levels of care. There are those who need nursing care in terms of having a visiting nurse, a visiting doctor come to their home because they are not mobile or because they are post-op and they have a particular need, someone to check bandages and change a dressing, whatever that need may be. That is something that can be provided to all through their Kupat Cholim, regardless of which level of insurance you have, as long as the family doctor determines that the need is so. And therefore, for that limited amount of time, you may have that visiting professional come to your home. It may not be exclusive only to a nurse or a doctor, a family doctor, but it may be OT, it may be PT, depending on what your need is at the time. There's also what we call nursing care under long-term care. Long-term care is when you need a caregiver at home, a caregiver who is either going to provide hours of care or who is going to provide 24 hours of care. That is something, again, as I mentioned, the Kupot Cholim have a long-term care benefit. It is called CUD insurance, where age and pre-existing conditions may be taken into effect. The Bituach Leumi, remember our friends, the Bituach Leumi, the National Insurance Institute, they also, by law, offer a long-term care benefit so that everyone has eligibility for long-term care as necessary. However, as with many socialized systems, your passive worldwide income will be taken into account for eligibility for this particular benefit. For more information on that, please be in touch with your Aliyah advisor so that they can give you the exact information that is important to you or for the family member that's coming with you. Some of you may be questioning if you should let go of your foreign insurance. We spoke earlier about residency. For those of you making Aliyah from certain provinces in Canada, you know that residency is important for you to be part of your healthcare system. In the US, there is no such concept of residency. And there may be those of you who already know that you're going to be spending consistently 3 months every year to visit the kids, to go to Florida, to do whatever it is that you need, and you may decide to maintain your foreign insurance. And that's your prerogative. That's your financial decision. There are those of you who may just keep it for a year and then be ready and secure to let it go. Because honestly, the healthcare system is a hard system to feel that safe security. You've had your family doctor for the past 10, 15, 20 years. Of course, your family doctor also may be nearing retirement. But still, it's a system that you're comfortable with, that you're secure with. And when we are sick, it's a time that we feel very vulnerable. And navigating this new system takes time, takes patience. It also takes your ability to pick up the phone and ask for help. The Post Aliyah department is happy to help you navigate this system. There are private healthcare consultants who can help you navigate this system. And there's very often solutions to what the need may be at any given time. Please note that your foreign insurance, although you were able to perhaps use that while you were here as a tourist, it will no longer be available for you to use once you are a citizen. And then there's the concept of private insurance. Private insurance is something that is accessed through an insurance agent, the same insurance agent that's going to provide you with house insurance, car insurance, and the like. You can also discuss with that insurance agent what private insurance looks like for you and what it covers. You will find that, although very different, and sometimes different can feel very scary, the healthcare system in Israel is an excellent system and is available to all. And sometimes when we are involved in a new system, we want to fight the system to make it work for us. But you will find that the more that you work with the system will really work for you. And again, that doesn't mean that you shouldn't call and call and call again for assistance so that you can feel secure on how to navigate that system. Now, you may be saying, well, I am going to travel, but I don't want to keep my foreign insurance. So, how will I be insured when I travel on vacation, when I travel back to wherever? And the Kupot Cholim also offer you travel insurance. However, it also may be determined by age how long they will cover you for and what that cost looks like. You may turn to your insurance agent, again, that same insurance agent that's providing you with home insurance and car insurance, to find out about travel insurance. Or you may want to turn to a company like Passport Insurance to understand how they will cover you. Understanding how your pre-existing conditions will be managed when you have any type of outside insurance while you travel is very, very important, and the responsibility is yours. Everyone has concerns when it comes to navigating the healthcare system. It doesn't matter who you are. Can you prepare till 120, but what about this, but what about that? It's really important for you to focus on your today. Who are you today? What medications do you take today? What are your healthcare needs today? Now, you may already have a healthcare need that has a past and may have a future. And researching how that's going to be managed is, of course, very important. It is crucial that you come with some sort of summary. No doctor is going to read your Megillah. No doctor is going to read 50 pages of medical history. And I don't even know if doctors use paper anymore. Right, Sarah?
Probably not.
But come with a summary that is explaining to your new doctor from your physician abroad where you've been, where you are, and where he sees you going. Some of you may decide to have all of your testing done prior to arrival so that it's fresh and you can now show it to that physician. But the physician might say, this is great, but now I want you to repeat that testing because I want to see those markers for myself. If you are a person who has, God forbid, some sort of serious background and you know that you need some sort of imaging every quarter, twice a year, whatever that may be, that will not be denied. Of course, you will receive that testing. Imaging, all pre-cancer testing is covered by the basic level of care. And of course, that is something that even you will get an SMS from your Coupa. Did you get your whatever it is? We see that you are this age or that you haven't had that test for the past 10 years once you are living here a while. You are of a certain age, you are invited to come in for your flu shot because people over the age of 60 will be eligible for flu shots in Israel before the rest of the population. Know who the people in your Kupat Cholim are. And so when you come on a pilot trip, because we encourage you to come on that pilot trip, that very important business trip that you will take, pop into the local Kupa that you think that you may want to join. Do you hear English? What languages do you hear? Can you go up to the secretary and speak in English? And will she just look at you like, I can't help you in that language? Or will she also speak English? It is very common for family physicians and specialists to be able to communicate with you in English, but not necessarily the pharmacist and not necessarily the people at the front desk. Understand, network, research your needs. In that summary of medications, in that summary of your physical needs of where you've been, it's important for a doctor to explain why you take medication B and not medication C, and so forth. I'm trying to be very specific so that you can be specific with your doctor at home. The most important thing is for you to feel secure. Now, some of you may take medication. It's not uncommon. And Israel has a drug registry where you can put in English your medication of choice. Is it called the same thing? Is it the same compound? Do you have a patch when otherwise in Israel it's available in a pill? Do you take an odd milligram that isn't going to be available in Israel? This is all information for you to be proactive with your Aliyah advisor. The Aliyah advisor is there to help you with your needs. He or she is not going to want to ask you your very personal business, your very personal needs. But if you bring those things up to them, they will be able to provide you with the resources necessary for you to explore that very important information. Let's say your medication is not going to be available in Israel and you wish to import it, or you have a certain plan that's going to last you till 120 and that medication will cost you $1 or $2. I'm always amazed, Sarah, when I go to fill my mom's prescription abroad and I pay, $1.50 for that prescription. Now, medications here, if it's covered by the basic medical basket as determined by the Ministry of Health, probably won't cost more than $4 either. We're not talking about a lot of money here. But there is still maybe those of you who wish to import. Before you make that first import, understand what it means to import medications. Can all medications be imported? Anything that is cannabis-based can never be imported, regardless if you have a license from abroad or not. I will just make one comment here about medical cannabis, Sarah, is that the process is very different here. We have an article on our website, and I encourage you all to read it if that is something that is already part of your medicinal regimen. Because again, your feeling secure is of utmost importance to us. Feeling secure may be knowing how to fill your mental health needs. What emotional support might you need? Making Aliyah, Sarah, is a noted traumatic event in a person's life. And perhaps you have a mental health background. Perhaps you've never seen a therapist or spoken to a mental health professional, but the Aliyah is not going the way you planned. You're having a little bit of internal strife yourself or with your spouse, and you would just like someone to help ease that along. The Kupot Cholim do offer mental health support with psychologists, with psychiatrists, and all Kupot Cholim also have a social worker. And you may want to go to the social worker to discuss some of these things. You may want to go to the social worker because you have a disability and you want to know how the Kupat Cholim will service some of those needs, if they'll service some of those needs. You may, God forbid, have a disease and you want to know how your Kupat Cholim will service that need. Will the Kupat Cholim offer you a cap of medications? Meaning, if you have a certain, God forbid, syndrome or disease and you take a lot of medications, you may never have to pay more than a certain amount of money a quarter, and that the rest of your medications will be free if you met that cap. This is something for you to discuss either with the social worker or with the secretary at your Kupat Cholim. Get Help Israel is a fantastic database of English-speaking therapists throughout the country. Have a look. See if your present need may be better serviced by a private therapist and what that private therapist will cost. Because although the Kupot Cholim system do offer psychologists and psychiatrists, getting a mental health professional in your spot in your mother tongue may be a little bit more challenging. And this is a place where we want someone to really understand who we are. Not only that they speak English, but that they understand the mentality of the culture from where we came. There also may be a very long waiting period to have mental health services through the Kupat Cholim, and therefore you may want to start with somebody from the private sector. This goes back to balancing your budget, and you know what your needs are and what is going to go into preparing for your Aliyah budget. But most importantly, know where to turn to gather this information, whether it's going to be Nefesh B'Nefesh, whether it's going to be networking with family and friends already in Israel, or professionals within the mental health field.
We have talked about a lot of different topics. As you can see from our roadmap here, we're getting down to the end of our presentation, but there are things this is a new system, and learning to navigate it will take time and patience and resilience.
There are certain vocabulary words which may or may not be discussed in Ulpan. For example, a hafnaya. A hafnaya is a referral letter because now your doctor wants you to see a specialist, and that particular specialist requires a referral. And the referral will state why your family doctor is referring you to this particular specialist. Or it may require what's called a hitchayvut. This is a financial promissory note from the Kupat Cholim stating, yes, we are going to pay for this individual's MRI taking place in the hospital. But it takes time to learn all of the things that you see here on the screen. We're not going to go through each one of them, but know that there are solutions to helping you navigate this system, whether they are hiring a private healthcare consultant or they are using some of the healthcare connections that we have, Sarah. Now, that's not a connection for you to say, hi, I'm moving to Ra'anana and I'm not sure if I should choose this kupa or that kupa. Those connections that we have for the Kupat Cholim is specific to understanding how a need will be managed here in Israel. I take this medication. I am going to need dialysis 2 days after arriving. These are going to be what my needs are. How does this Kupa manage those needs? And you will be able to write to those contacts in English. And it won't matter where you're moving to because the answer that you will receive from those contacts is a national answer. Case management works very differently here in Israel. Although abroad, I also see that case management is not what it used to be. And you may find yourself being your best case manager. And that can be very tricky in a new language, in a new culture, when you don't know how things work. You're told that it's going to take 3 months for a certain appointment, and you just take that as a given. Don't take that as a given. What can you do? Can you be put on a waiting list? Or is there an organization that can help you get a sooner appointment? Can you be flexible and go to a different city to that particular specialist? Because that particular specialist might have offices in a variety of locations. These are not things that you will know when you first arrive. Please turn to us in the Post Aliyah department so that we can help you navigate that system. When you will go to your Kupat Cholim, to the clinic in your neighborhood, which will be one of your first post Aliyah steps to get your what's called a magnetic membership card. That's a good time to ask your personal questions. Where should I turn if I have an emergency in the middle of the night? Where should I turn if the clinic is closed and I have an emergency during the course of the day? Where do I get my prescriptions filled? How do I make an appointment? These are all things that perhaps you have taken for granted all of the years that you will have been living in your country of origin, and a new system that you need to learn to navigate here in Israel. Be proactive. You have your own personal points to ponder. Only you know what your medical and personal needs are. It may be getting a handicap tag for your car, which is not an international tag. It may be understanding that Israel has a computerized system, and so that everything about you is going to be in the computer, and if another doctor needs to access that information, they can. Your information is private, but they have access if necessary. There are 24-hour call centers with each and every kupa, so that if you need to speak to a nurse or a doctor at 3 in the morning because you're not sure if you're having an emergency, or all of a sudden you spike a fever as an older person who has 103, 104, that may necessitate a visit to the emergency room. It will be up to them to guide you as such. And what about a living will? And what about durable power of attorney? Things are different in Israel. Know how the system can work best for you so that you can work best within the system. Plan, research, and reset as necessary. We have both spoken a lot about the importance of planning, how to research, whether that's through Facebook, WhatsApp groups, email groups. Today, in the 21st century, there's no shortage. And yes, you might need to be a little bit more outgoing than you naturally are to say, hi, this is me. I'm moving to your town. Are there hospitals in your city if you do not know? Is there this or is that? Also on our website, you will find community contacts because perhaps you've always dreamed about moving to Haifa, but you don't really know anybody in Haifa. And so our community contacts page will offer you individuals within your age group who can answer some of those questions. Use the resources that you have available because helping us help you feel secure is what we aim to do in your pre-Aliyah experience.
Miriam, I just wanted to end this amazing presentation to say that we, as in the pre-Aliyah division, in the Aliyah guidance division at Nefesh B'Nefesh, look forward eagerly to hearing from you. Please speak to your Aliyah advisors about your healthcare needs and about your healthcare questions.
And we look forward to welcoming you home.